The Compliance Perspectives podcast is sponsored by Athenian, a leading provider of entity management and governance software. Get started at www.athenian.com. Welcome to the Compliance Perspectives podcast. I'm Adam Turtletail from the Society of Corporate Compliance and Ethics in Healthcare Compliance Association. Joining us today from Washington, D.C. is Jillian Willis, a partner at Nelson Mullins, and joining us from Fort Lauderdale is Melissa Scott, an associate there. And today we're going to be talking about the HHS OIG's Nursing Facility Industry Segment-Specific Compliance Program Guidance. Jillian, Melissa, thanks for joining us. Jillian, can you provide an overview of what's in the guidance?
Yes, HHS OIG in November of 2024 released updated Nursing Facility Industry Segment-Specific Compliance Program Guidance, which is a mouthful, so we will call it Nursing Facility ICPG or just Nursing Facility Compliance Guidance. And the guidance was released in an effort to modernize how HHS OIG is communicating information to the industry and to provide information about risks, how to mitigate those risks, and to provide some best practices for people in the nursing facility industry. Initially, about 20 years ago, in 2000, HHS OIG published guidance for nursing facilities in the Federal Register. They updated that again in 2008. But today, we see that they are moving away from the Federal Register and putting this guidance on the HHS OIG website so that individuals in the industry can have more access to this information. And it's an interactive interface on the website. At its core, however, the guidance is a 59-page document that is divided into several different sections. There are 4 main sections related to the compliance risk areas and the recommendations for mitigation. Those main areas are quality of care and quality of life, Medicare and Medicaid billing requirements, a primer and discussion of the federal anti-kickback statute, and then a section on other risk areas such as physician self-referral laws, otherwise called the Stark Law, HIPAA privacy and breach notification issues, and anti-supplementation rules. So that's kind of an overview of how the document is set out. And I think we'll talk a little bit more about some specifics in there as we go along with our discussion.
Absolutely. Now, the document contains within it some voluntary compliance best practices. Why, Melissa, should organizations be taking these steps?
Sure. So the most important reason really is that it enhances patient quality of care and quality of life. And the ICPG guidance really emphasizes that. Nursing home facilities, the patient care is so important. Nursing staffing minimum requirements that directly affect patient care. It all comes down to ensuring that patients are cared for and they have trust in the healthcare system. And on top of that, patient care really drives so many other compliance risk areas like billing or coding, payment incentives and kickbacks, referrals, staffing, credentialing, all of that. So patient care, focusing on that and implementing voluntary practices for that is really going to help bolster your compliance program in other areas. The second thing would be risk mitigation. So implementing these guidelines, even if they're non-binding, is going to help an organization identify compliance issues in areas that they could be at risk at and could maybe lead to investigations, litigation, penalties, hefty fines, and maybe even jail time. So this will get an organization ahead of the field and make sure that they can protect themselves for any risks down the line. And the other thing that the ICPG brings up a lot as well is that it'll improve your operational efficiency. So developing streamlined and robust compliance programs and procedures that are adapted to the individual patients, to the individual organization, that will strengthen efficiency of the facility or organization as a whole. And it will help, comply with the law, generate business for the practice, and of course, like I said, most importantly, deliver quality patient care.
And good quality of care is what we want either as patients, family of patients, or as professionals. Now, Jillian, are there other resources that nursing facilities may consider when assessing their compliance programs and whether to implement a compliance program if one is not already in place?
Yes, in fact, one of the motivating factors that the ICPG lists is that there's enhanced coordination between OIG, CMS, and DOJ. And it's important to look at all of these entities when assessing a compliance program. OIG has general compliance guidance that was updated in November of 2023. And the ICPG instructs to read the industry specific guidance alongside the general compliance program guidance. Now, that general compliance program guidance underscores 7 main elements of an effective compliance program: written policies and procedures, compliance leadership and oversight, training and education, effective lines of communication with compliance officers and disclosure programs, enforcing standards, having consequences and incentives, risk assessment, auditing and monitoring, and finally, responding to detected offenses and developing corrective action initiatives. Not only does the ICPG discuss the general compliance program guidance from OIG, but it also directs readers to the CMS requirements of participation. Now, the ICPG voluntary guidance is not the same as those mandatory requirements of participation that CMS has put forth. CMS has minimum requirements that nursing facilities must meet, and the ICPG should be read in conjunction with those minimum requirements. And then finally, looking at DOJ guidance. DOJ has guidance about evaluation of corporate compliance programs, and DOJ has also put forth policy statements and white collar initiative statements about what the priorities are. And one of those main priorities is eliminating fraud, waste, and abuse, or enforcing fraud, waste, and abuse matters at the DOJ, especially in the healthcare field.
So in addition to all these guidances, there's also the indirect guidance that comes from recent enforcement actions and what you can take away from them. Melissa, have there been any recent actions that are worth noting?
Yes, there's been a few. The ICPG guidance highlights this as a hot topic. Nursing facility compliance is receiving increasing scrutiny from the DOJ, from other federal agencies. Just last week, 2 Pittsburgh nursing homes were hit with over $15 million in penalties of restitution for failing to prioritize patient care, which, as we talked about, is the overriding factor that drives other compliance. In this specific case, the nursing homes were actually falsifying their staffing records. So I kind of mentioned that minimum nursing staffing levels is hugely critical aspect of compliance in this area. They not only were understaffed, but were actually putting names down on the staffing and saying that people worked who weren't even there, and then submitting that to get federal funding and avoid kind of any scrutiny or penalties for being understaffed. And this actually directly affected the patient care in that case, because there was, at the sentencing hearing, there were victims testifying about their impact, and one patient was actually assaulted because no staff were there to intervene. So it directly affected vulnerable patients and their quality of life. And then another case earlier in January, another nursing home company and its CEO were found guilty for fraud and conspiracy there. And again, the overarching principle is that they prioritize profits over patient care. They diverted CMS funding that was directly supposed to be used for patient care and equipment and things like that for their own personal expenses, and kind of distributed or diverted those funds to owners. And as a result, they couldn't fund, basic minimum requirements and meet regulations for patient care. And the patients suffered as a result. It compromised their care, and particularly the residents' quality of life at the facilities. And they also failed to pay other vendors that affected patient care and misdirected their employees' tax withholdings. So this is a hot topic. It affects a lot of compliance areas, and it's going to keep, being enforced and scrutinized over the next few years.
It's going to definitely be interesting to see how things evolve. Well, Jillian, Melissa, thank you so much for sharing these insights with us today. I want to thank all of you for taking the time to listen. I'm Adam Turteltaub from SCCE and HCCA. I hope we're able to expand your compliance perspective.